When I started studying medicine 6 years ago, I wanted to learn everything about health. I wanted to save lives. So here I am, at the end of my studies, talking about the biggest health emergency of our time, the climate crisis. Emergencies can be overwhelming, which is why in medicine, for every real deal emergency situation, we are equipped with a toolkit. And this is exactly what I brought you today, a climate emergency kit with 5 simple tools. 5 tools you can use and become part of the life-saving team. Here's how. In med school, I've learned when we have an emergency patient, let's say after a really bad road accident, massive bleeding, ruptured organs, broken bones, blood everywhere, we don't just stand still, we move. We get the emergency kit, we treat. Every second counts. What the emergency of the COVID pandemic showed us is that we can move fast, even on a global scale. We closed down whole airports, we mobilized huge amounts of money, and we developed corona concepts for every single institution. So I said with the question, if we can make huge changes for COVID, why are we not willing to make radical changes for the climate crisis? Well, I don't know about you, but before med school, I simply didn't know that the climate crisis is a health emergency. Most of us don't, which isn't a surprise because unlike for COVID, our governments don't communicate that climate change is damaging our health today. To understand the emergency, we need tool number 1, a brain. I hope you all got one with you as well. Perf. Because in the hospital with every incoming patient, we need our brains to analyze how urgent the situation is. What's the heart rate, blood pressure, the temperature? So let's check out our numbers. 9 out of 10 people living on this planet breathe in polluted air. This leads to over 8.8 million deaths every year. Big numbers can be confusing. This means that over the past year, more people died due to air pollution than because of COVID. And on top of this number, we can count the deaths caused by heat waves, storms, flooding. And even if you survive, those extreme weather events seriously impact our mental health, causing post-traumatic stress disorder and anxiety. What about the temperature? Right now, we are on a 1.2 degree hotter planet compared to pre-industrial levels. Our planet has a fever. Scientists say that 1.5 degrees is the maximum for us to continue a healthy life. Take again our emergency patient. Our team will do anything to avoid a fever, to keep the body temperature well below 40 degrees, because over 40 degrees, it gets hot, and 41 degrees is like, whew. And at 42 degrees, our patient dies. We don't say, oh, this patient will probably have a high fever anyways, sometime in the future. So isn't it already too late? Why should I even bother? It's the same for the 1.5 degree goal. Of course we can pass it, but it will cost millions of preventable deaths. Every degree matters. This is why last month during COP26, health professionals, including myself and 45 million others, we sent a letter to our governments urging them to protect our health and do everything they can for the 1.5 degree goal. This is not just any emergency. The climate crisis is the biggest health emergency of our time. As I said, when our brain realizes that we're right in an emergency, this can be overwhelming. Last year, in the intensive care unit, when we had a patient crashing in front of us, I didn't feel capable of handling the situation on my own. I'm not a surgeon. What am I supposed to do? Use tool number 2, our voice. Med school taught me, don't panic, prioritize. I can speak up to point out that there is a patient bleeding out in front of us and ask my team to move. Action is better than anxiety. And this sounds quite simple, but that was a major aha moment for me when it comes to the climate emergency. Learning that this is a health emergency, I realized that anytime, anywhere, I can speak up and ask questions. At any meeting, at any conference, at my university, I can talk with my colleagues, with my politicians, with entrepreneurs, NGOs. It's even a good pickup line for a date. Hi, how do you feel about having a future? Of course, this takes courage, because it might be uncomfortable to be the one who asks questions. I think it's even more uncomfortable to have a patient dying in front of you and not talking about it. So this is what I did. I kept speaking up, asking for climate justice, starting from uni to our National Medical Association, ending up at the WHO last year. And here I am today, asking you, how do you feel about saving lives? I'd say we start with our biggest patient, planet Earth. Our planet is bleeding. Now, think of the fossil fuels that we're extracting from Earth, like the blood that our patient is losing. There's a maximum amount of blood one can lose without dying. That's our carbon budget. If we exceed this budget, the patient crashes. The latest IPCC report from the summer says that at the current speed, our carbon budget will be finished in 8 years. Now, we can try to buy ourselves a bit more time by catching up some blood and putting it back into the patient or sticking on Band-Aids. But this is not sufficient. If we really want to save our patients' lives, we need to prioritize where it bleeds the most, the fossil fuels, and stop the source immediately. So why does it feel that our governments are moving in slow motion? Well, for moving faster, we need tool number 3, our feet. In the hospital, we move fast, and we use all the tools we've got. We do further clinical examination, a CT scan, we run a blood screen, we try, we readapt, we try again. Fighting the symptoms will help only in short term, but it won't save our patient's life. And this image of symptoms fighting is similar to the way our governments do health and climate politics at the moment in Switzerland. In Switzerland, we call this Pflasterlipolitik, Band-Aid politics. We see a problem, we stick a Band-Aid on, while blood keeps running. Our employees are flying around to meet with customers. We just carbon offset the flights. Too high CO2 emissions? We just externalize them, subsidize harmful technologies. Carbon capture, business as usual, empty promises, blah, blah, blah. Why is all the blood gone? Oops. This is why the IPCC report calls for systems change, not climate change. Or, as David Attenborough puts it, we cannot be radical enough in tackling the climate crisis. I know, this word, radical. Well, what surprised me is that from a health perspective, this makes total sense. Radical comes from the Latin word radix, which means root. And this is exactly what we want for our health. We want to address the root of the problem. Back in school, I learned that we as individuals are responsible and need to reduce our own carbon footprint. Only last year, I heard who actually invented the carbon footprint calculator. BP, one of the biggest fossil fuel companies. Focusing on our own carbon footprint keeps us busy with Band-Aids, while missing out on the tiny detail that only 100 companies, BP being one of them, are responsible for over 70% of all global greenhouse gas emissions. Going radical down to the root of the problem, we find the paradigm of infinite growth, that there are no boundaries. But think about it. Infinite growth in the body, in medicine, this means cancer. Our body has boundaries, and so does our planet with its limited resources. The planetary boundaries. There are 9 of them. Only within those 9 boundaries, humans can live healthily for generations to come. And with this new paradigm of planetary health, we can treat the system. We stop the bleeding, we stop the fossil fuels. Job finished. Wait a sec. Our patient isn't over the edge. We still have a fever, damaged organs, broken bones. We need help. And this is where tool number 4 comes in. Our hands. In complex cases like these, in the hospital, we reach out for help. We involve many different experts and work together with the team and decide together. For the climate emergency, the catastrophe is we don't include the whole team. The ones in power, the politicians and CEOs of big corporates, they take decisions without including the people who are affected the most, which is absurd, because the people who are affected the most are the least responsible for the pollution. This is why we call for climate justice. Because in a warming world, these health inequities only increase. And there is no green and healthy future without social justice. The future is intersectional. So what does this mean for me? Well, I can ask myself, who's missing at my table? Which voices are yet unheard? And then I use my hands to reach out across sectors, across generations, across borders, across genders, and then I invite everyone, the whole diverse team, to the decision-making table. We join forces. One of the most astonishing things that I learned over the past years from working in hospitals all over the country and abroad is you don't need to become a doctor to save lives. If you want to save millions of lives, address the climate emergency. It's a win-win situation. You wouldn't believe it, but radical climate action has such a good return on investment that you would dream of having your bank offering you such a good rate. For example, if cities decide to build safe cycling lanes and more people decide to take the bike instead of the car, we're not only free of pollution, but physically active, which leads to less heart attacks and increases our mental health. Ka-ching, life saved. Or if we stop eating meat every day and move to a plant-based diet, we not only massively reduce emissions, but also reduce our risk of cancer and improve our sexual function. And who doesn't want that? This is why we call it health co-benefits of climate action. The climate crisis is not only the biggest threat to our health, it's also the biggest opportunity. This is where we come to the 5th and final tool. What is the one thing that we're all really missing in our everyday lives? Time, right. When in your weekly schedule do you take the time to really reflect on the emergency we're living in, with all its urgency? After the IPCC report was released in summer, my fellow catalyst, Lucina and I, we asked ourselves this exact same question and wondered, if we keep being busy with our everyday hustle, it's getting freaking hot in here. And we don't want to die of a heart attack during a heat wave. We need a new approach. Something everyone can do, no matter where, no matter when. So we took a break, an emergency break. Everyone needs to pause for a coffee or lunch, right? And we just dedicated one break per week to the climate emergency. It's like in the hospital when before rushing into the operating room, we do a quick break to check in with the team. It's not about pausing to ignore the emergency. During an emergency break, we face how urgent the situation really is. We give space to all the emotions that can come up. We listen to each other with empathy, with an open heart. And we dream, we talk about our visions and let new ideas grow. So, as you can see, this is what we've been doing, and the idea has been spreading all over Switzerland, almost as fast as the new corona variant, because everyone can do an emergency break. You can do one. You could start by asking 2-3 fellow students for a lunch break or colleagues from work, and instead of talking about the stock market or your brunch plans for Sunday, you just talk about the climate emergency. Look around in this room. We're in one of the best business schools in the world. Many of you will be future CEOs. If you dedicate one break per week, now in December, we'd already have more than 1,000 potential CEOs addressing the emergency by the end of the year. All I want for Christmas is you, joining the team to save lives. So, dear team, good news. Looking at the time, we do still have a small window of opportunity. And no fancy medical tools needed, just 5 simple tools. 1, our brains to analyze the emergency. 2, our voices to speak up. 3, our feet to go radical. 4, our hands to reach out and join forces. And 5, a break, a regenerative moment for action. A healthy future is possible, and it's only waiting for you to move. Let's go.